Hi, my name is Dr. Amy and I am a chiropractor at Impact Chiropractic in Fort Collins. Today we are going to be talking about prenatal and Webster Technique. Prenatal chiropractic is a specific form of chiropractic of, yes, we're still working with the nervous system, making sure that it's turned on, flowing to the rest of the body, but we're really working with mamas specifically in order to make sure that they don't have as many aches or pains, that baby has as much motion as possible, and really to decrease and improve labor overall. So when we look at what we do specifically with mamas, we use the Webster Technique. So Webster, you need a specific certification in order to perform correctly. There are certain marks that we want to make sure are getting checked on every mama. And what it is, it's a mixture of our spinal tissue that we do with everyone, where we're working on that nervous system, as well as some of the soft tissue that really just gets overworked in pregnancy. So with Webster in general, we will start making sure that hips and sacrum, there's no rotation. This allows to make sure that we have as much opening during labor and delivery, but also helps to reduce some of that sensation and some of those aches and pains during pregnancy. We will work with piriformis and your glute muscle. This can often get really tight, but when we release it, it helps stabilize the hips more, decreases the chance of getting any sciatic sensation. I love holding sacrotuberous ligament, and sometimes many chiropractors actually miss this contact. What this is, it's between your tailbone and your sits bone. So it's kind of low off the midline, but what it is, it's a great calming adjustment. It really helps bring your nervous system down into a parasympathetic state, which is awesome. We love doing it with babies too. But it also brings that coccyx up, so there's more room and opening for babes to come out in labor and delivery. Then we'll definitely address every spine. We'll do low back, mid back. We do cervical as well. Again, nervous system opening and controlling all the muscles. This helps uterus contract efficiently and effectively, helps all the nerves going into growing babies, so baby's developing correctly. But even in the mid back and shoulders, neck too, we do have some growth happen in here during pregnancy, so it's nice to have a little bit of tension release, as well as supporting milk production when we get there. We do some work in the front as well. We will work with hip flexor as well as round ligament. What is great about these two contacts is it decreases tension through here, allows babes to have more motion, versus when they're tight, it really clamps down that uterus, so babes can kind of get stuck off to one side. So a lot of mamas really enjoy when that's released. Another contact we will use is pubic symphysis. So this one and the sacrotuberous ligament are sometimes missed because they are in more sensitive areas, but honestly really important to make sure that they are getting addressed. It is right in front. What that does is making sure it's in a good spot will allow for the most opening, because this will open quite a bit during labor and delivery. If it's off at all, baby can get stuck. It doesn't open as efficiently if you've ever heard of shoulder dystocia. So definitely, again, a lot of spinal structural contacts we take, but then mixture of soft tissue to make sure that we are giving mamas the best care. Yes, for pregnancy, but really prep them for labor and delivery. So when we specifically look at all the benefits, they're so vast. When we go into pregnancy itself, so many mamas get aches and pains, random swelling, your body just shifts so much. So it helps you stay as comfortable as possible, helps baby develop as much as possible and as fully as possible, and then really gets your body ready for labor and delivery. So every mama wants a shorter labor and delivery and easier labor and delivery. So many studies have shown how it will decrease labor times, especially in those second time moms. When they show first study where they had natural labors without chiropractic, and the second one with chiropractic, it decreased by quite a bit. So I love working with mamas, yes, in pregnancy, but really to prep their body, have as much opening, and have really efficient contractions. So very important, yes, for all the benefits, but it's really just to keep you healthy during this next stage of life and keep your baby healthy.